All right, what's up, guys? Welcome to Diabetes Talk. I'm your host, Charlie O'Connell. We are broadcasting live from New Haven, Connecticut, right here in the GlucoSEZONE studio. I want to do a huge shout out to everybody who just joined us for that awesome level 3 strength training workout. Guys, if you have not joined us yet for one of these workouts, make it happen, okay? And make sure that you've downloaded the GlucoSEZONE app and you're tracking your diabetes information in the GlucoSEZONE. All right, couple shout outs before we get started. Veronica, I see you in the app. Veronica, it is great to have you here. And Veronica, I want to thank you for the feedback that you gave us, that we got this morning about our new trainers. Guys, we are in the process of coaching right now a whole new group of fitness personalities who are people living with diabetes, fitness professionals, and people that are passionate about fitness that we are about to bring to the world. And I was so appreciative, Veronica, of your feedback of one of our coaches that we put on camera for the first time yesterday. He was very nervous. And, sometimes you got to throw people in the water, so to speak. So I appreciate it, and it's great to have you here, okay? Jeanette, awesome job, Jeanette, with that strength training workout. And let me just answer your question that you brought up at the end of that workout. And yes, it is absolutely okay to substitute floor-based exercises using the wall, okay? That is totally acceptable, and I would encourage it, okay? Listening to your body is that's how you actually become a fitness person, all right? So you absolutely can substitute anything we're doing on the ground, you can do from a standing, modified, or wall position. All right. Couple other shout outs. Donnie Ray, I see you. And on Instagram, Sue has joined us. Sue722, it is great to have you here. And the Beaties has joined us. Great to see you, the Beaties. Marisol is joining us on Facebook. Guys, we have so many people joining this community of people that are ready to take the fight to diabetes and are basically willing and able to put in the hard work, okay? And if somebody is selling you some sort of bogus information and they're saying, oh, it's going to be easy to manage your diabetes, it's going to be easy to lose weight, it's going to be easy to reach your fitness goals, they're not telling you the truth, okay? This is a hard process. Is why we exist is because we know this is a hard process, and we are here to provide you the support that you need, okay? All right, so today's focus, today's subject is living with diabetes and arthritis. And this is such an incredibly important topic. Arthritis is basically one of the top comorbidity conditions that are associated with diabetes. So let me break that down a little bit because we haven't actually really talked about that. That could be a whole nother diabetes talk subject. But really quickly, the common comorbidities that are associated with diabetes are hypertension. So 1 out of 2 people living with diabetes have hypertension. Heart disease, okay, arthritis. Those are basically the top 3 comorbidity conditions that are associated with living with diabetes. So arthritis is what we're going to be talking about today, all right? And my team has done an incredible job of putting together some very, very useful information. I have to give a huge credit right now to Lorianne, who is our resident CDE. She is an absolute expert, diabetes and fitness professional with an incredible knowledge base of health in general. So she did a great job of putting this together, and we're going to follow her script today because this information is right on, okay? So the first thing, guys, is when you are talking about diabetes and arthritis, there are a few things you need to keep in mind. The first thing is type 1 diabetes, okay, is an autoimmune condition where the immune system attacks and destroys the beta cells in the pancreas, okay? And the reality is that nobody knows exactly why that happens. It's one of the most frustrating aspects of diabetes today, and specifically for the type 1 community, okay? There is no definitive cause, understanding of why the immune system attacks the pancreas, leading to type 1 diabetes. But the bottom line is that is what happens. So type 1 diabetes is an autoimmune disease, okay? Whereas type 2 diabetes is not an autoimmune condition. It's considered a metabolic disorder. And what the disorder is characterized by is insulin resistance. So your body's cells have become resistant to the effects of insulin, and you ultimately either need to produce more insulin, make your body more sensitive to the insulin that it is producing, or substitute insulin with prophylactic medications. The danger with type 2 diabetes is your body will respond to insulin resistance by actually increasing the amount of insulin that the pancreas is producing, and that ultimately can lead to what's called pancreatic burnout. And what pancreatic burnout means is your pancreas has produced so much insulin that it literally cannot produce insulin anymore. And people that are taking sulfonylureas, which is a class of drugs for type 2 diabetes, this is a side note from this conversation, but a very important side note. If you are taking a sulfonylurea is a class of type 2 diabetes medication, an oral medication. What a sulfonylurea does is it stimulates your pancreas to produce more insulin. And people who are on sulfonylureas need to be very careful for pancreatic burnout. All right, that was my little rant on sulfonylureas. Now, why do we bring this up? Why did I start off this whole conversation with bringing up the fact that type 1 diabetes is an autoimmune disease and type 2 diabetes is not metabolic disorder? The reason why I brought that up is because when it comes to arthritis, it is a very similar situation, with one form of arthritis being an autoimmune disease and another form being a non-autoimmune disease. So, inflammatory arthritis, okay, is the general term for the autoimmune form of arthritis, where the immune system attacks a person's own tissue, causing inflammation, pain, stiffness, and swelling. Okay? The most common form, or most well-known form of inflammatory arthritis is rheumatoid arthritis. Okay? And there is another form, and you're going to have to bear with me here, ankylosing spondylitis. Okay, and psoriatic arthritis. So those three forms of arthritis are autoimmune related. Okay, and again, what happens is the person's autoimmune system attacks the tissue, causing inflammation, pain, stiffness, and swelling. All right, that is different from degenerative arthritis, which is also known as osteoporosis. Excuse me, osteoarthritis. Okay, osteoarthritis is the most common form of arthritis, and it is not an autoimmune condition. And basically, what happens is the cartilage that cushions the end of the bones, okay, wears away, and the bones rub against, it's bone on bone. Okay, and that causes pain, swelling, stiffness. Okay, and loss of strength and chronic pain. So, very important to understand and distinguish the type of diabetes that you're talking about, and is it an autoimmune condition or not, and then distinguish the type of arthritis that you are talking about. Is it caused by autoimmune issues or not? Okay? Very, very important to do that. Now, degenerative arthritis or osteoarthritis is the most common form of arthritis, all right? And there are millions and millions and millions of people that are suffering from that. okay? Now, another thing that's very, very important to understand when we're talking about diabetes and arthritis is something called the formation of advanced glycation end products, okay? Advanced glycation end products accumulate due to the normal aging process, okay, and is accelerated by hyperglycemia, okay? Hyperglycemia means high blood sugar, and this can cause a decrease in joint mobility in people living with diabetes, and it can mimic the symptoms of arthritis, all right? And there's a term called diabetic frozen shoulder. So diabetic frozen shoulder is much more related to advanced glycation end products than arthritis, all right? And that can be very, very painful, all right? And all of these forms of arthritis can be painful. So these are, every time, guys, we have a conversation, this is one of the reasons why I really enjoy these diabetes talks, is because, number one, these subjects are so important to break down and understand in language that can actually be understood, all right? And it is so important to distinguish these different variations and forms of diabetes, distinguish in, the variations and forms of arthritis in this case, because the only way that you're actually going to get to a solution for the pain that you're feeling or the issue that you're having is by really, really identifying it. And in many, many cases, it's a combination of two things. All right? All right, let me stop right there. I've got a ton of people that I want to acknowledge. I want to acknowledge Daisy. Okay, Daisy has joined us on Instagram. Frank has joined us on Instagram. Marat has joined us in the GlucoSezone app. Okay, Carrie has joined us on Facebook. All right, guys, it is really, really great to see you here. All right, now, let's keep going. Okay, and Claudette has joined us on YouTube too. Claudette, it is great to see you here, and you did a great job in that workout. Now, in order to manage arthritis appropriately, okay, it's important to know which type you have. That's a guaranteed, right? That's the whole point in basically distinguishing, is this autoimmune, or is this degenerative, or is this actually something else? All right, now, what is the good news? The good news is that exercise is extremely helpful in managing all of those arthritis and non-arthritis conditions, all right? So, why is that? Well, let's start off with, okay, flexibility and balance. Flexibility and balance takes the pressure off of your joints, takes the pressure off of the cartilage, takes the pressure off of the tendons, okay, and reduces that bone-to-bone grinding that we were talking about with osteoarthritis, all right? So the more flexible, the more supple your muscles are, the less tension and stress is going to be on your cartilage, on your tendons, and on those tissues, all right? What's actually amazing, and again, Lorianne doing a great job of really breaking this down and researching it. So the reality is, okay, is the joint systems of osteoarthritis, when they are mild to moderate, can be managed with stretching and consistent physical activity, all right? So if you are experiencing osteoarthritis in a moderate form, exercise is absolutely a fundamental and preferred way to start reducing the pain that you're feeling, okay? Now, the second thing is, okay, is generally speaking, the more you're focused on balance, the more you're focused on flexibility, the more you're going to be taking pressure off of joints, cartilage, and tendons, okay, that basically are at risk for injury and are the actual pieces of tissue in your body that are affected by arthritis. So we want to be building up those muscles. We want to be flexing and contracting them on a daily basis. And you can literally start off, guys, with toe raises, ankle circles, and calf raises. And I'm going to use an example. One of my dear person in my life, one of my coaches went through a terrible physical challenge, okay? And I'm not going to go into a long story, but basically he had a severe issue with his kidneys and had become almost crippled. And the crippling was then exacerbated by lack of activity. And he went through a several-year process of fighting for his life, ultimately coming back out of it the other side, but now his body had completely, his muscles had completely degenerated, and he was suffering from extreme arthritic conditions, okay? And what we literally started with, guys, was toe raises. And you would be amazed, but just starting with the flexion of your foot, what that can do to start to rebuild your body, okay? And that's one of the reasons, guys, why we focus on all those little exercises we do in our warm-up. All those muscles below the knee are the fundamental muscles and exercise routines that encourage balance and flexibility. So if you are suffering from arthritis, just the motion itself, okay, practice it. Do it, whatever it may be. If your hand is feeling arthritic, practice flexing, okay? Stretching. I don't usually advocate using props for stretching, but in this case, okay, in this particular case, using a prop, using a band, using a chair to better assist you in your ability to stretch your muscles is absolutely the smart thing to do, okay? So I want to encourage you to do that, okay? I want you to take the time. If you spend a lot of time at your job sitting and your knees are constantly bent in a 90-degree angle, you have to stretch them, okay? If you spend a lot of time driving, okay, and you feel your lower back starting to become incredibly stiff, you have to stretch. It is just a fundamental part of feeling better, okay? And using assistive devices can be incredibly important and powerful tools for you. Now, what I would say with assistive devices is you want to use those assistive devices to engage your body in a stretching process, but you never ever want to use an assistive device to put your body at risk for further injury, okay? And you have to have common sense with that. And working with a professional is definitely something that I would recommend, okay? So stretching, when I say an assistive device, I'm talking about using a towel to help you better stretch your shoulder or your arm, okay? Using a towel to help you better stretch your leg, okay? The other thing is, guys, don't just go right into static stretching. That's one of the most common mistakes that people make with fitness is, and if you do any of our GlucoZone workouts, guys, we always spend 10 minutes warming up, but we do something called dynamic stretching. And what dynamic stretching is movement of the muscle that has the effect of stretching, engaging, and getting the blood flowing into the muscle. And that is a much, much more effective way of stretching than just straight into static stretching. You never, ever, ever want to just do static stretching. In fact, it's the exact opposite. Static stretching really should not be done until after the workout, or if you're doing yoga, And you'll notice this, guys, if you're with a good yoga teacher and you're going through a vinyasa or a flow, they will take you through a whole series of movements. And there we go. Okay? They'll take you through a whole series of movements, okay, where you're actively and dynamically stretching before you get into a static stretch pose. All right? So, and you can trust, guys, that when we do GlucoSezone workouts, we're going to follow that formula. We always follow the first 10 minutes, okay? All right. Let me stop right there. I want to encourage you guys to ask questions. This is a very important topic. I also want to do a shout out to Joe Yu joining us. Joe Yu, it is great to see you here on Facebook. Lorraine joining us. Lorraine, it is great to have you here. Okay? And Sharon, thank you for joining us. All right? And Sharon, I saw you doing that workout today as well, and you did a great job. All right. Okay. So Jeanette just, great question from Jeanette. Jeanette just asked, do you think people with asthma and diabetes is a good chat? Because that is a big struggle. Okay. Jeanette, that's a fantastic comment. So this comes back to comorbidity conditions, right? And asthma is definitely a common comorbidity condition when it comes to diabetes. And asthma can be incredibly frustrating because as a person living with diabetes, you know that aerobic exercise is good for you. But aerobic exercise can be extremely challenging with diabetes. With asthma. So here are some just some suggestions. If you are struggling with asthma and diabetes, okay, I want you to do two things. The first thing I want you to do is I want you to start focusing on weight training. Generally speaking, bodybuilding, okay, weightlifting will have an incredible effect on improving your sensitivity to insulin and building up your body's ability to store glycogen properly, okay? The other part of that, and why I bring it up specifically with asthma, is generally speaking, weight training is not as aerobic and does not have an aerobic requirement like walking, for example, or running, or any of those things, okay? So if you are struggling with asthma, look into strength training routines, okay? Weightlifting routines. I want to encourage you guys, if you download the GlucoSezone app and you go into the GlucoSezone program, you will find gym workouts designed specifically to help you reach your goals while utilizing equipment, okay? So that's the first thing. The second thing is you should talk with your doctor if you're continuing to really, really suffer from asthma, okay? There may be other factors that you're not considering. And this is one of the most important things, guys, is once you've made that commitment to take the fight to diabetes, okay, and your heart is in it, and you're set, and you're like, you know what, I'm ready to do this, I'm not letting excuses stop me. Then you run into something like asthma, or you run into something like arthritis, you have to then become an expert in your own condition, and you have to educate yourself. And just like we just broke down, arthritis actually has different variations, okay? The asthmatic condition is the same thing. There are different forms, different severities of asthma, and the asthma kicks up for different reasons, okay? And, just off the top is, where are you doing your workout? Are you doing your workout in an environment where the quality of air is not good? First question, right? An experiment. Does changing the actual environment where you're working out impact the asthmatic condition? All right. Several other people have joined us on Instagram, so I want to recognize you guys. The Insulin Interceptor has joined us. I love that name. It is great to have you here. And Sheffrey Monneque. That is a very interesting Instagram name. It is great to have you here. I think that's actually Chef Raymond Neque. So Chef Raymond, it is great to have you here on Instagram. Thank you for joining us, okay? All right, now, there was another question that just came through on YouTube that I missed. I want to address it, okay? Okay, great question. All right, so the question that just came through is, what time do we go live? All right, so this is it. Guys, we go live every single day in the GlucoSezone app at 10 a.m. Eastern. And we create something called the GlucoSezone Today, right? And it is a different workout every day. It is led by fitness professionals that are people living with diabetes or expert diabetes professionals that offer you great exercise routines that you can follow and match your diabetes information to those workouts. Now, that happens every day at 10 a.m., okay? And on Tuesday, Wednesday, and Thursday, we do a 6:30 p.m. live broadcast. Now, on Tuesdays, we do that in YouTube, okay? On Wednesdays, it's just in the GlucoSezone app, and on Thursdays, we're back in YouTube as well at 6:30, all right? And we always love having you guys here, okay? I want to encourage you, though, taking the fight to diabetes is an everyday thing. We are here every single day, and I just want to encourage you, if you have not done one of our 10 a.m. workouts yet, if you haven't done any of our workouts that are only in the app, download the app. Just try it, okay? Just try it. It's free. Try it out. Just see how getting in the GlucoSezone on a daily basis impacts your diabetes, okay? All right. Now, wow, that was a very, very quick 30 minutes, okay? Diabetes and arthritis, very important topic. I want to thank you, Jeanette, for suggesting that we cover diabetes and asthma. That is a great question, a great suggestion, I should say, and we're definitely going to do that. And you know, we're also going to do a full diabetes talk on, just generally speaking, diabetes and comorbidity conditions, because it's such an important thing to understand, okay? And there are so many ramifications to not understanding how diabetes and comorbidity conditions affect each other, all right? So thank you so much, guys, for joining us. Everybody on Instagram, on Facebook, on YouTube, thank you so much for joining me in the GlucoSezone for Diabetes Talk tonight. I want to see you tomorrow morning, Wednesday, 10 a.m. or 6:30 in the GlucoSezone app. And then right back at you guys on Thursday. We are coming back live, okay, on YouTube at 6:30. Up, Pedro. Okay, Pedro, you snuck the last question, and I was just about to wrap it up. The lights are getting turned off, and Pedro, you snuck one in here, okay? So let's answer this question. Pedro says, sometimes I feel tingling and swelling in the hands along with pain, and I've noticed two of my fingers, okay, are a little out as if arthritis is starting on them. What should I do? Okay, so Pedro, it's a great question. Many people suffer from arthritis, but there are other causes of hand issues, okay? And especially if you spend a lot of time on the computer, okay, what I would encourage you to do is look into the different variations of arthritis, okay? The different variations of what causes swelling and pain in the knuckles, in the fingers. I want you to distinguish between neuropathy and arthritis, okay? Because those are two different things, and they're managed in two different ways, okay? And ultimately become an expert in your symptoms, and now utilize technology and information to start to really, really identify what's going on with your body. All right? And on that note, we are going to sign off. Thank you guys so much. It was a great talk. I can't wait to see you guys in the glucose zone.